Hello, everyone. Today I'll be discussing a critical topic in oncology: secondary malignancies following radiation therapy. This presentation will explore the risks, causes, and emerging technologies related to this complication. My name is Archisha Singh, and I look forward to talking you through this important subject. Cancer remains a major public health challenge worldwide, affecting millions of people each year. In the United States alone, prostate cancer is the most frequently diagnosed cancer among men, accounting for 21% of new cases. Among women, breast cancer is the leading type, with 29% of new cases. Despite various treatment strategies, lung and bronchus cancers are the leading cause of cancer related deaths in both genders. These statistics highlight the urgent need for effective treatments and ongoing research to improve patient outcomes. Cancer treatment has evolved significantly, incorporating various approaches like surgery, chemotherapy, and radiation therapy. Often, these treatments are combined in a multimodal approach to improve survival rates. Radiation therapy, in particular, is a cornerstone of cancer treatment. It can be delivered internally using brachytherapy or externally using high energy beams to target the cancer from the outside of the body. The primary goal of radiation therapy is to damage the DNA within the cancer cells, leading to their death or preventing their replication. While radiation therapy is highly effective, it also carries certain risks. This treatment works by inducing DNA double stranded breaks in cancer cells, which can lead to cancer death. However, this process can also damage the DNA of nearby healthy tissues, increasing the risk of developing secondary cancers. This potential side effect underscores the need for careful consideration and planning in radiation therapy. Secondary malignancies are a rare but serious complication of radiation therapy. They occur when the treatment intended to eliminate the primary cancer inadvertently causes a new cancer to develop later on. Several factors can increase the likelihood of secondary malignancies, and understanding these risk factors is essential in mitigating them. One of the most significant risk factors for secondary malignancies is the age at which a person receives radiation therapy. Children are particularly vulnerable due to their longer life expectancy and increased sensitivity to radiation. Studies have shown that children are up to 10 times more likely to develop secondary malignancies than adults, largely because they have more time for these cancers to develop. Gender also plays a role in the risk of secondary malignancies. Women are generally at a higher risk than men. This increased risk is partly due to the higher radiation exposure at younger ages, especially for cancers like breast and thyroid. Historical data, such as from the atomic bomb survivors, shows that women have a 58% higher risk of developing solid cancers from radiation exposure as compared to men, who have a 35% increased risk. The timing of radiation exposure can also affect the development of secondary malignancies. For instance, survivors of the atomic bombings in Japan were first diagnosed with leukemia shortly after the event. However, years later, these individuals began to develop solid tumors, illustrating the long term risks associated with radiation exposure. This temporal association highlights the importance of long term monitoring for patients who have undergone radiation therapy. The technique used in radiation therapy can significantly influence the risk of secondary malignancies. Older radiation techniques exposed a larger amount of normal tissue to radiation, increasing the risk. Even with advanced radiation techniques like intensity modulated radiotherapy, IMRT, and image guided radiotherapy, IGRT, there are still concerns. For instance, IMRT can expose more normal tissue to low doses of radiation, which can increase the risk of secondary malignancies over time. IGRT, while improving precision, also contributes to additional radiation exposure during setup, further raising the risk. Different types of radiation also play a role in the likelihood of developing secondary malignancies. Proton beam therapy, PBT, has shown a clear advantage over proton therapy in this regard. Due to the Bragg peak effect, PBT allows for more precise targeting of the tumor, with minimal radiation dose to surrounding healthy tissue. This reduces the risk of secondary malignancies, making PBT a preferable option in many cases. In conclusion, while radiation therapy remains a powerful tool in the fight against cancer, it is not without risks. Secondary malignancies are a rare but serious complication that underscores the need for ongoing research and refines of treatment protocols. As we continue to advance in medical technology, there is hope for more effective and safe cancer treatments that minimize these risks. Thank you for your attention.